Good afternoon, everybody. My name is Sarah Harris, and I'm the Director of Programs at West Virginia Free. We are so excited to welcome you to day 2 of our reproductive health convening. Today's topic is comprehensive pregnancy options training that West Virginia Free is really proud to present. This is one of 3 trainings in our program curriculum. So yesterday you heard all about Love Your Birth Control and how that's an unbiased, comprehensive look at birth control options that are really tailored toward the patient's needs, desires, and wants. Today, we're going to talk about comprehensive pregnancy options in the state of West Virginia, and that can cover how to give unbiased counseling to an individual on whether they choose to parent, choose adoption, or choose an abortion. And then tomorrow, we have a deeper dive into our SAS program, which is our 3rd program that we offer at West Virginia Free, which is self-managed abortion, safe and supported. So thank you so much for tuning in today. We have chosen to do this convening a little bit differently this year. We're doing it virtually on this platform. We're then recording it so that we know life gets busy and things happen. You can come back to this at any point and pick up right where you left off to learn all about your options here in West Virginia and the different services that we at West Virginia Free and our partner organizations have to help support you in your journey where you are. So without further ado, I would like to introduce you to today's presenter, Dr. Yvonne Lee Long. Dr. Yvonne is our voter engagement organizer and our training extraordinaire for comprehensive pregnancy options. And I just want to kind of put a little bit of a disclaimer out there today that this is a training demonstration. Our in-person offerings have an expanded opportunity to engage with individuals, coach them, and help them to identify and overcome any intentional or unintentional biases when referring somebody for support. Today, we also have with us the wonderful Lauren McCoy, who is our outreach organizer's stepmother, and Chris, who is our amazing summer intern turned fall intern. And so they're joining us today to kind of role play as a person, a clinician who is getting this training in a setting so that we have some interplay. You too in the audience are a part of this training. So if at any time you want to participate or ask questions along the way, please drop them in the chat across any platform and we will be sure to get to those. All right, Yvonne, let me get the slideshow ready.
Okay.
And then we will get going.
All right. Good afternoon, everybody, and thank you for having me today to be able to talk to you about the comprehensive pregnancy options training. We're going to start a little bit with some icebreakers so I can find out, a little bit about you out there in what I call TV land, online land, and everything like that, so we can get comfortable with each other. So today, I want to go around, and Sarah, you call on who because you can see them, you call on them, and I want them to discuss with me. Tell me something about your first job, and then tell me a little bit of something about your worst job, and then tell your name and let me know where you're from.
Let's start with Chris. Sorry to pick on you first, but thank you so much.
It's no problem. So my name is Chris. I am from all over the place, but I call Huntington my home right now. My first job, I worked very, very briefly, first and worst job, for exactly one shift as I was supposed to be selling insurance, is what I thought I was doing. Selling insurance to people on the phone. Turns out that was in fact a scam, and I had accidentally signed up to scam people. And I found that out very quickly, and I never went back.
Thank you so much, Chris, for sharing that. I'm sorry to hear about that. Did you have a story to tell about your favorite job?
Oh,
no,
yeah, my favorite.
You don't have to say West Virginia Free.
No, honestly, West Virginia Free is probably my favorite job I've had so far, just because it's like I don't know. It feels so good to be doing the work that we're doing, and everyone has been wonderful, and I've always felt so safe from the get-go. I mean, just a wonderful work environment, doing great work. I found it actually kind of fun to like work with the data, kind of get in a zone. And numbers are easier to work with than people are sometimes.
Mm-hmm.
Thank you for that, Chris. All right, Lauren, your turn. What was your worst job?
Okay,
And then your best one.
My name is Lauren McCoy, and I am from West Virginia, and now we live here at the beach in North Carolina. My first job was Chicago Pizzeria Uno's, and my worst job was a restaurant down here that I won't name that I worked for just a few weeks, and it was it was not a good experience. And then my favorite job is probably now. I am an instructor at the college. I teach culinary foundations, baking and pastry, and then each month we have a specialized class. And so I think that's my favorite job is mine now.
Okay.
Now, remember, audience, you can participate in this too. I see Margaret's watching us from YouTube. So feel free to engage with this, via comment. If you would like to actually participate in this training, just let me know. I can always bring you on screen too if you're brave. So just let me know. Yvonne, are you ready to move on?
Okay. Well, let me just introduce myself. Okay. Let's just let you guys know a little about myself. Okay. So my first job was at Pioneer Chicken. I don't know if you guys know about it, but it was a fast food restaurant. And that was my first job and everything. My worst job was working in business banking. I worked for Washington Mutual as a business banker. And that was really my worst job. It came with a lot of stresses and everything. My favorite job is all my jobs now, because I'm a social worker. I'm a doctor and social worker. My favorite job is helping people in every aspect. So West Virginia Free, my teaching, me working with the youth, all those are my favorite jobs. I am living my best life right now as a social worker because I think that I was raised to give back. I was raised to be able to help, to be able to connect people to resources and things like that of that nature. And I think every time I do it, I'm living my best job. So whether I'm at West Virginia Free, working in the capacity here as a community resource, or just working at the university in my teaching and helping people advance and become a social worker. So those are my favorite. Those are my favorite jobs.
I love that.
Okay. So we're going to just jump right on into this, and let's begin to talk about and give a brief overview of what this is all about. Today, we're going to be training and talking about adoptions, abortions, and choosing to parent. And I want you guys to remember those names and just how we called it out and everything, because we'll delve into that here in a little while. We'll be reviewing some resources for each one of these things, and we'll be referring to neutral resources, you know what I'm saying? So like that unbiased resources and the help that you can get. Because like Sarah stated in the beginning, our training is very unbiased, it's very neutral. We're not trying to persuade one way or another. We're just trying to deliver the information. You know how they say knowledge is power. So when you're informed and you have that information, you have that power to be able to choose and do what you want. So that's what this training is all about. Each of us have our own values, like I said, and we're willing to do it. Make our choices, and me, like I said, it's pro-choice, choice to do whatever you want to do, one way or another. Be yourself. I love it. The best choice is like the choices of the client, so that's why we're empowering you. And I just want to put a little disclaimer out there for you in here that I'm not a lawyer. I'm not a lawyer or a doctor I'm just here providing some information. Okay. And so that's what I'll be doing, just providing that information in the capacity of just being a lay person, giving you that information. Okay. So let's move right along here. Did you do the sign-in sheet? Are we going to do the sign-in sheet and the surveys?
We're not going to do the sign-in sheet right now. Again, this is a demonstration, but if you are joining us virtually, if you wouldn't mind to drop in the chat your name, your pronouns, where you're from, and we would love to hear from you out there. But yeah, for the purposes of today, we are going through our entire training, but we are not doing it in a traditional way. This is just more of a preview. Again, if we were able to do this at your site or with your team, this is a deep dive conversation that we can really get into and uncover those biases and provide you with the source material that Yvonne is going to be referencing throughout this presentation.
Right. And just to let you know, like you see right there, that these courses do qualify for CEUs. So if we sign you up and if you sign up for the trainings, you can offer CEUs. And like I said, my favorite job as a social worker, we're always looking for good CEUs, them continuing education units and everything. So this course can be able to offer that. So if you guys want to give this training and you guys want to come out and everything, you guys can offer that to people to be able to encourage them to come. All right, let's moving right along. We're going to do a little bit of goal setting here, okay? So everybody get out a piece of paper. And I just want you to take a moment to write down some things that you really want to get. Write about one or two things that you really want to get out of this, in your position and everything and what you understand about pregnancy options and everything. So write about one or two things. And then try to jot down one or two things that you want to work on. Say maybe you guys offering your sites or you guys understand things about pregnancy options. This is not just what you have at your place, but what do you understand? I want you to know, what do you understand about pregnancy options? One or two things. And then one or two things that you want to work on. What would you want to be more understandable? What would you want to be more knowledgeable about when it comes to pregnancy options? Because they have a vast options out there. And sometimes people are really narrowed down or they've only been exposed to a few. So what are one or two things that you want to work on? What would you like to know more of? Has everybody done that, or do you guys need a little bit more time? Kind of like wave if you guys are done and everything so we can move right along. All right. That's what I like to see. Okay, so what I want us to do, and like I said, normally in a training, we will kind of like put you guys in groups or we're in person. Like I said, if we had this training in person, it would be really great because you can just turn to your person on the side and chat with them about some of your goals or, or chat and everything. But so for right now for that, since we're out here in TV land, online land and everything. I want you guys to share with me, share with the group here and everything. Can we get someone to come on the mic to kind of read off what they wrote down?
Thank you, Chris.
Yeah, I was going to say I will. So the thing that, and again, this is me as like role playing as I decided a social worker. One or two things that I'm doing really well is being considerate of my client's specific needs. So assessing, their ability to care for a child, what physical, emotional resources they have. And something that I want to work on is specifically learning about how to refer to the adoption process, because I know there are like closed and open, private, a ton of different ones. And also learning how to explain this to a client in a way that makes sense. Because I think that's one of the things with adoption is that there's so much to it. It's very intimidating to try and explain.
Thank you for that, Chris.
Thank you for that.
Lauren, would you like to share?
Yes. I I think the want to gain would be resources to connect, making it realistic that these really are all options. So really being connected with the right resources. And also, I think that this reminds me of like Maslow's hierarchy of needs, meeting them where they are whenever they come in. If they're really frightened, scared of, a lot of young people, if they're frightened or something, we need to meet the need before we can provide any options. Because if they're already frightened, it's going to be really overwhelming. So I just think making sure to be responsible in meeting the need before I can give any advice for anything, before they can take anything in, even if it's down to getting them a glass of water, giving them space to breathe for a minute. But really gaining an understanding of resources is something that would, just as humans, period, I think as women, as humans, being able to be a resource. I work with a lot of young people, and being able to be this resource, being able to connect with resources, I think would be really important.
Thank you, Lauren.
All right.
I wrote some things down too. Do you want me to share?
Yes, go right ahead. Definitely, I want you to share. I want everybody to share.
If you in the audience want to share too, drop them in the chat. We want to see them. So one thing that I think that I do really well in my position is I'm really good at like the broad strokes about topics and projects, but what I really would hope to gain from this is the details. So becoming more comfortable in talking about hard topics, and understanding and being able to really express and connect in an empathetic way, even when the situation, because the situation isn't mine, and because we need to be sensitive to what's best for the other person in that moment. And then I would also really hope to gain some resources that I can share, tangible resources that I can then provide to the person as takeaways. Because as Lauren said, sometimes when you're in that fight or flight mode, if things are very hard and heavy, right then in that moment is a really hard time to make those decisions. But to have a takeaway that I can then, come back to as I need it, and when I'm ready to, that would be a great resource.
Okay. All right. Well, that's good to know. And do we have any questions out there? I guess so we can move on. Well, the reason today we even had you guys like write the stuff down. There's meaning behind everything we do. They say there's things behind everything we do. And so when you wrote that down and you wrote those lists down, the same thing about being helpful is the same thing you do when you're referring people out. It's like that's how you handle people. That is like the basis of how you handle them. When you're being helpful, that's what you want to do in a referral. Because when you refer, you want to be helpful. You want to give them the best of what you have to offer. And I always tell people, when you're doing things, think of what you would want to be done to you. Treat others how you want to be treated, basically. And that's how it all is. When people come to you and you can think, and I always say, put yourself in their shoes. That saying, put yourself in their shoes or walk a mile in their shoes. Always when you're doing that, think of the other person. And then when you think of the other person as yourself. Okay. So we're going to be moving right along and everything. We're going to talk about the STAR model. And in your folder, we would have something about the STAR model in your folder, but we're not today for sake. We're not going to give that back out. But I will talk to you about the STAR model and using the STAR model to be able to do referrals. Okay. So the STAR model, when we talk about it, say the STAR, S, being supportive. Know your role in the face of the patient's needs. So that's what I'm saying. Know before you go. We're giving you the knowledge. Know before you go. Supporting the client's decision, not trying to put what you would do onto the client, but allow the client to talk about what they want to do and then say, hey, that's fine. That's fine. Let me help you do this. Let me help you do that. You know what I'm saying? Can I connect you to a person for this sake and everything for that matter. So being very supportive, always be thorough, be knowledgeable. That's what that T is. Have the correct information about the services they need. Be able to connect them to the right resources, because you got some resources, for one way, you got some resource for another. Don't make that mistake and send somebody that wants something somewhere else. Be very knowledgeable about where you're sending them, because that can make or break a person. Calling something that, hey, I didn't even ask for this. So be knowledgeable about the care that they're seeking. So when they come to you and they ask you about different things, adoption, abortion, be knowledgeable in that. Be knowledgeable what they're asking you so that we can send them to the right places. Be active. Being active means being in the moment, help them, assist them, help them schedule, help them take care of their needs, and actively access their needs. Sit up there and be supportive. Make those calls, do for them and everything. If they need childcare, if they need different things and stuff like that, how they say, be active, be present in the moment and be able to help. And the referral quality, that's the R in it, the referral quality. Follow up. Ask about it. Ask about how they feel about it. Ask about what they received. Were they helped accurately? You know what I'm saying? Did my help even help them? Do they need anything else? Did I leave something out? Sometimes, you know what I'm saying? Maybe what they came for, we just didn't get it. But if you ask, it allows them to be able to refer back and say, hey, well, you gave me all this, but do you have this information about just this? And a lot of times when you open up and you ask them, they'll let you do that. And always, like I said, the referral quality, always use their experience to better help the next client. Like if they tell you, hey, I was looking for this, but I didn't get this, always jot that down. Always jot that down and say, okay, I'm going to make sure that I share that with somebody else that came and asked that question. Because we say there's not just one perfect answer to anything. And me, I always tell people, I'm always out trying to seek knowledge, knowledge first. I'm not the know-all be-all, but I've always told myself, if I don't know it, I'm gonna go find it. And that's what I think helps the best with everything. So, all right. So, choosing to parent. Remember I said, watch those words in the very beginning, choosing to parent. When you choose to parent, that's a choice word and everything. So that's the words that we use when you choose to parent. So the West Virginia, as well as in the United States, the appropriate language is choosing to parent and not keep your baby. So you see what I'm saying? Not keep your baby versus choosing to parent. They're two different things. So you just say, hey, you're just keeping your baby. No, you choose to parent. And upon that, once you choose to parent, West Virginia, you get a proof of pregnancy. It's considered a life event. And then you qualify for different things like Medicaid and, Medicare and stuff. So you qualify for these different things when you choose to parent. So you can get the care that you need. From that point on, once you choose to parent, you have the ability to go and get some Medicaid and get some medical insurance and different things like that. And you have to be able to access this resource so that you can go. Because a lot of, young girls don't know, what I'm saying? They were like, hey, I don't have insurance. They stay out. They don't go to the doctors and stuff like that. So that's the first thing that you really want to give them when they say, I'm choosing to parent. And when you use that, that's really an unbiased term when you say choosing to parent. So in that event, they're eligible for the Medicaid and everything. So I'm pregnant doesn't always look like this. Look, no, it doesn't. Because right now, being pregnant right now, that's what it looks like. All on social media. The gender reveals and all the happy go times and everything sometimes. And a lot of people look at social media because it's influencing everybody. That sometimes that's what they think it's all about. but it becomes a little bit harder. It becomes a little bit more difficult. So you want to be there for the difficult times and everything like that. So now we're going to move on to adoption. Okay. And we have several different options in adoptions. Now you have what they call family adoption. You got open adoption and you got closed adoption. So let's talk a little bit about what these different things are. Okay.
Sorry, Yvonne, you might need to stop me when it's time to change a slide. I'm trying to keep up on dual screens here, so I apologize for that.
That's okay. Okay, so we'll just talk here at the top about familial adoption. This is where a family member or a close member of your family comes in and they adopt your child. You know, usually in this event, you know who's getting your child. You guys probably already talked about your child and everything like that. And you guys can go through the agencies, or you just go through the proper protocol and the family adopts your baby. Then you have what is called an open adoption. An open adoption is one of the most common types of adoptions, and it's where the biological parent and the adoptive parent has an adoption plan related to the contract. So basically, you guys are coming together, and you guys are making this decision. And then at a lot of times, you can ask the person at adoption, can you still be involved? Can they send you information and everything? That's more of an open adoption and everything. So they keep you involved in that, but it's not a family member. And then a closed adoption is just when you go through an agency, you don't know who's getting your child, you don't know. And basically when you sever ties, it severs all ties. That child goes on to be raised by someone else, and you do not have that connectiveness to it. You can't call, you can't check, you can't, like I said, you don't even know who's getting your child. And sometimes that's better for some people versus the other. And like I said, and if that's what you choose to do, then that's what you choose to do. You know, I know people that have done them both, you know, and, you know, I asked them, I said, why did you choose the closed adoption? And the young girl just says, because I really want to make it as it never happened. I've helped somebody and I'm just severing all ties because that's not my child any longer. I've asked the ones for open adoption, you know, and they refer to it as, hey, you know, I got pregnant, didn't know the father, but hey, I may want to see how this baby turns out, but I know that I could not raise them because I was not in the position to raise them. I could not financially support them, and all that's okay. So when they have these different choices, they do this in these different mannerisms and everything like that. And then, you know, that good old family adoption. Auntie comes in to help out, uncle, sister, brothers, and they come in and they adopt the child and everything, and they take on the full responsibilities of the child. And then you probably end up referring to the child as your cousin, your sister, you know, your nephew, your nieces, and things like that, and things just move on. So those are the different adoptions. And moving on to the next slide, let's talk about adoption supporting language, planning an adoption for your child. And the planning on an adoption for your child, these are just languages. As you go through adoptions, you go through different phases. I was about to skip over that. So planning to adopt your child, that's your first phase. You've come to the thing that I'm going to adopt. That's your first phase of it. Then you choose an adoptive family for your child. Hold on one moment. This door is knocking. Let me get them off this door so I won't be here. No. Sorry about that. That was somebody at my door and they was going to keep on knocking. Sorry about that. Now back on this. So you choose your adoptive families. But like I said, remember, in the closed adoption, you won't have this phase. The choosing the adoptive family for your child, you won't do that in the closed adoption. Then you talk about the birth mother, the birth father, and then the birth parents. You know, who are they? What are they? And what part of, you know, that they have in this ordeal. In deciding to parent the child, these are different languages that you'll use. Like it says, when they talk about the birth mother, the birth father, the birth parents, those are the ones who actually conceived it and gave birth to it. those are the languages that how they refer to you from that point on. When you're talking about adoption, you become the birth parent and they actually have the parent. You become that. So that's why those languages are used. And deciding to parent the child, that's on the other end. Who decides? That's the person on the adoptive side who's taking the child because they decided to parent that child, whether it's a family member, whether, like you said, you had the open or even the closed one. And those are the different languages that you would hear them use when you're talking about adoption. So be very clear in understanding what these words are, because sometimes when you use them, sometimes people are like, they get offensive. When you say, you're the birth mother. They, no, I'm a mother. I'm a mom. You're the birth mother when it comes to adoptions. So, you know what I'm saying? Be very clear on that and everything, and support them and let them know what that means. You're a very important, intricate role in this, but you are known as the birth mother from here on out. All right, moving right along. Okay. So the abortion supportive language is, you always want to mirror the language of the client. What did the client use? What does the client call it? You know, like I just gave you, I gave you some supportive language. Then again, that's the norm. The supportive language that we were just talking about is a norm. But then when they come back and say, you always want to mirror the language of the client. When you're helping somebody, what they refer to it as, you refer to it as. What they refer to it as, you refer to it as. Okay? Let the client name the feeling. Don't dictate it for them. That's very understandable, because in this is like they're giving birth and it's going to be very emotional. Don't never tell the client how to feel. Just flow with it. Just let them, be there and be a support system for them. And then encourage them to find some personal support. Because adopting a child out may end up in you having to refer them out for therapy. Know that, it's okay. It's okay. Adopting your child out after giving birth is not an easy thing. So just be very, just be very supportive. Dispel misinformation and myths. Because, people, they'll get out there and say, oh, you're a poor, they talk about, when you want to adopt your child because you gave birth and all this stuff. But take all that away. Take all the stigma out of it. Take all the stigma out of it. Let this be a flawless process for them.
I would just like to add that this model here also is the same language that you would use to support a person who is electing for abortion. You would still mirror the language of the client. If you go into that counseling session and you get the sense that they just really aren't sure that they want to parent, that is their option. That is okay for them to feel that way and to express that to you. It does not need to be your own personal choice, because it's not your own personal choice. So you're going to mirror the client. You're going to let the client name the feeling, and you're not going to dictate it for them. You're going to dispel information and misinformation and myths surrounding the abortion landscape. And then you're going to encourage the person to find a personal support if possible. Choosing abortion is a very personal journey for individuals, and therefore having that support person with them that is their friend, their confidant, their partner, that's going to be incredibly helpful to them on their journey.
Okay. All right, contraceptions. Moving right along, contraceptives. West Virginia Free is in a partnership, as you know, with prenatal partnerships, and have an outreach campaign called Love Your Birth Control. So this campaign focuses on counseling, from directive counseling, where you counsel someone starting with the effectiveness of the contraception, to the person-centered counseling, where the patient client decides on what they would like to learn about, their contraceptives. So you can please reach out to us if you would like. To schedule the training and receive fantastic Love Your Birth Controls, because we come out and we teach you, we bring out all the stuff, what it is, how you use it, what it looks like, and different things like that. And we give you I guess, and they give you, it's like a little box of stuff, because I went to it, you know, they have like this little box of stuff and everything. So when you go out and you train and you get along, you know what it looks like. Because sometimes people talk about different things and they really don't know what it looks like the IUD. They'll talk about it and they don't even know, you know, what it looks like and different things like that. So you can allow them to see what it actually is and everything. All Title X sites offer free low-cost contraceptions, which is priced on a sliding scale. So rather, if you have a job, if you don't have insurance, you still can get some contraceptions because it's a sliding scale. And these sites will also give prenatal vitamins too. So not only contraceptives, but prenatal vitamins and pregnancy tests. We have a vast amount of Title X sites in the state, and they can be seen on your loveyourbirthcontrol.org. So if you go to loveyourbirthcontrol.org and go on there, they will tell you about all the options and all the sites and everything. And at this point, I'll probably say, here, let me put the link in the chat. If you guys want to have the link, you guys can copy the link and keep it and use it for yourself, right? Emergency contraceptions is a type of birth control and is safe and can be purchased over the counter. You know, those Plan Bs that everybody's getting right now, those are birth control methods, and they can be purchased right in the store and everything like that. I've always said, if you don't have a plan A, you always got to have a plan B, okay? You can purchase those over the counter. If a person takes an emergency contraception when pregnant, they will still be pregnant, and it is not an abortion. It is not an abortion. So if they go and they're pregnant and they think they're going to take this pill and they're going to abort a baby, they're not. They're not. And we have to understand, and we always have to remember that abortions are illegal here in the state of West Virginia. So, you know, people are going to try different ways of doing different things, and they can kind of harm themselves, or, you know, it can be in everything. So you have to know about this. You can also highlight that there has never been a death or a serious side effect linked to emergency contraceptives. Whatever the myth may be, they've never been linked. There's been no emergencies or no deaths linked to that. So STI and HIV testing, that's the next slide. Let's go ahead and go on. The Title X also has STD and HIV testing sites. And right here, we have it written down for a list of areas and testing locations. There's a 1-800 number you can call. And for free confidential HIV oral rapid test, there's the 1304 number. And you can find agencies that do that as well. And those are all funded through Title X. So like I said, everything is done on a sliding scale. You got pregnancy and HIV. Next slide.
I would like to lift up just for a moment here. If you missed yesterday's reproductive health convening, we had a deep dive conversation on Love Your Birth Control and the Title X Family Planning Network. So if you'd like to refer back to that live recording on any of our social platforms that you're viewing from today, you can learn a lot more about those training curriculums that we can do on your site with your staff. Or if you are a community member who just wants to learn more on your own about the different options, that's a really excellent resource for you. So I just wanted to lift that up, Yvonne, and then I'll finish the slide.
Okay. And pregnancy and HIV. Per the CDC, when you're pregnant, they want you to take an HIV test as early as possible. They want you to take the HIV test as early as possible for really one thing, to find out if you have HIV or not. Because if you do have it, you can begin to be treated for it early on in your pregnancy. And when you're treated on it early on in your pregnancy, it's called the antiretroviral. I can never say that word. Can you spell it? I can never pronounce that word. Therapy. Call it ART. The ART therapy. That's what it is, because that word, I get tongue-tied. It can be used to prevent the transmission. So just because you have HIV does not mean your child will have HIV. Because there'll be some people that'll come to you that knowingly is pregnant and knowingly they know they have HIV. And that's one thing that's like their make or break, because they want to terminate because it says, I don't want my child born into this, or I don't want my child to have HIV. And just knowing this right here, you know, can help them make that choice if they want to have a baby or not. You know what I'm saying? That, you know, if we can get this early on, you can get the medication you need so it won't be transmitted to your fetus and to your child. And so it'll improve the health outcomes of both the parent and the child. Just having this pregnancy test, this early on pregnancy test. So that helps in everything. And then, like I says, right here, you'll have a manual that we have and resource manuals on services for these type of testings. Next slide. Okay, so we're going to revisit some goals from the earlier slides. So can anyone give one word to describe how you feel now on your goals? You know, the goals that you set for yourself and everything and what you want to achieve from this. Can anybody give one word? Go ahead on, Chris.
Confident.
Confident, okay. And why is this confident? What are you receiving to make you more confident?
Especially like the language around adoption and abortion that we covered. Definitely, because my goal was to work on how to like refer appropriately, speak appropriately to clients. And I think that would like hit it perfectly. So now I feel a lot more confident about that.
Is there something else you still like to learn when it comes to your goals? Is there something else down there that you still like to learn? I'm glad you're confident.
On my goals, that was my main one. My sub goal was to learn about like specific words to avoid and stuff. Mm-hmm. And I think that even though we haven't like had specific examples of those things to avoid, talking about like matching language, matching, you know, mm-hmm. seeing where they are emotionally, that's pretty good.
Right. Exactly. Okay. Anyone else would like to share?
I can go if you'd like.
All right, Lauren, come on down.
I would say the word for me would be more knowledgeable. I definitely feel I'm armed with more knowledge that's going to help. I was going back and forth between more knowledgeable and more prepared. But I think you did both of those in my goals.
Okay. All right. And so is there anything still left there for you to want to know more about?
No, I think I have been directed to where the resources that are going to be helpful for me. I think that you've covered them. And I agree with Chris about the language. I'm really the adoption supportive language and the abortion supportive language. I think those were really excellent to have in your back pocket. I really appreciate the supportive language.
Okay. And always remember, whenever you need, even after this training, if you want to reach back out to us and something and everything, and maybe, because as you go through these trainings, they're always very unique within themselves. Trainings are always very unique within themselves as you go through and everything, you know. But if I haven't touched that actual point that you want to, always, if in doubt, ask. Because as I talk and everything and I go through these trainings, I try to give you everything. And like I said, each one of my trainings is unique. Never one is like the other one and everything. But like I said, I'm always willing and I'm open to having those private conversations about it. And like I said, and I haven't spoke about it here. If it hasn't been approached here, I will always go out and seek that out. So know that West Virginia Free is here. We have an open policy and you can always reach in and reach out to us for that support and we will be here. Okay. All right. So, all right. But wait, there's more. Coordinate a comprehensive pregnancy training at your site for additional staff. Yes. So like I said, there's additional or new materials, additional resources and information, assistance with developing policy or plan. So we're here for it all. We're here for it all. When we say that, you know, not only for the training, but you can get all this from us here at West Virginia Free. Schedule 11 birth control training. You know, I just briefly touched on Love Your Birth Control and let you know that we do have this and we do team up, but we have a full training on Love Your Birth Control, getting down to the nuts and bolts of contraceptions. You know what I'm saying? Because there are quite a few of them out there. And it breaks the myth. We have a very good trainer that trains Love Your Birth Control and everything. It's great to know. Like I said, knowledge is power. Knowing gets you halfway there and everything. Schedule a self-managed abortion and safe supported training. And then whatever you need, call us. Call us, call on us, whatever you need. If we don't have it, we know how to go out and get it, go out and be able to obtain that information and bring it back to you and serve it to you. And so that's what we're here for at West Virginia Free. Next slide.
This is it. This is the one where if we were
You did the survey?
and
Okay.
in person, we would do the pre and post survey data. I'd like to take a minute just to lift up this piece in particular, because again, this was a training demo that you all saw today. In person, our return rate on our surveys show that we have a 98% satisfaction rate. People leave feeling some of the words that Chris and Lauren expressed, which was more confident, and they felt better prepared to have the supportive language that they needed in their back pocket to help the end patient, their client, their friend. What has been most remarkable about that 98% number is the number of people pre-survey who showed that they weren't comfortable talking about abortion and that they didn't feel comfortable to have those conversations and would often refer to a colleague to have that particular conversation. So if this is something that you feel could benefit you and your staff, your agency, whatever that may be, this is a training that we offer at no cost. We'll come to you, we'll come to your site with materials and a lot more long-term support. Is something like Yvonne said, this doesn't just end when we walk out of the room. We want to be a resource for you as things develop. So I'd like to take this moment to thank Yvonne for her time. I know she's at school right now. She wears many hats in our community, trying to make and shape the changes that we want to see here in our Mountain State. Mm-hmm. I'm going to open this up right now for some questions. I don't see any in the chat right now, but I just want to let you all know, if you had questions, please feel free to drop them. We'd love to get those answered for you. I'd also like to take this opportunity to invite you all tomorrow from 12 to 1:30. We are going to be on the 1-year mark of the West Virginia abortion ban. Our topic is going to be abortion. Where are we now? We're welcoming guest Susan Yano from the Self-Managed Abortion Women Help Women Coalition. She's the co-founder of that, and we're excited to host her, along with our executive director, Margaret Chapman Pompano, and then our amazing outreach organizer, Hannah McCoy, will talk about all of the work that she's been doing to develop an in-person and virtual self-managed abortion training. I see Chris clapping because Chris was a part of that with us this summer too, delivering some of our first in-person SAS trainings in the state of West Virginia. So with that in mind, we're going to end this session with a little mindfulness activity. As I mentioned yesterday, these topics that we engage in, these spaces that we work in, Chris, Yvonne, and Lauren, all of you watching, these are sometimes some of the heaviest spaces and the hardest work that we can do because it weighs on our soul and on our emotions and on our minds. And so when you're in a caring, helping profession, it's important to talk about carrying the weight together. And so as helping professionals, we tend to carry a lot of the weight of those that we are helping on us. And so today we talked about helping a person in a very high stress circumstance, an unintended pregnancy. There are many feelings and situations that come with having those conversations. And we tend to find a way, and we have to find a way to properly carry that load. So for today's self-care exercise, we are going to practice setting it all down. And I'd like everyone to close their eyes and take a deep breath. We're going to inhale for 3. 1, 2, 3. And exhale for 3. 1, 2, 3. And we're going to repeat. Inhale, 1, 2, 3. Exhale, 1, 2, 3. Try to hold this pattern of breathing while we move through this exercise. I'd like for you to envision that you have an empty bag beside you. It could be a backpack, it could be a purse, a grocery bag, whatever comes to mind. Pick this bag up and set it on your lap. What are you holding right now that you would like to set aside for a bit? Are there any thoughts that are buzzing in the back of your head? Something happening with a friend that is stuck in your mind? Do you have something that you need to finish, but you just haven't quite gotten to it? These are the things that I want you to put in your bag. Now zip that bag up and set it to the side. We are all holding things in our bags that other people can't quite see, whether it be things going on in our lives or the lives of someone we love, or even just something that's happening in the world around us. Sometimes, even just for a moment, we need to be able to set it down. So let's take a few more breaths while things are still packed away in your bag. We're going to do a count of inhale, 1, 2, 3. Exhale, 1, 2, 3. We're going to repeat it one more time. Inhale, 1, 2, 3. Exhale, 1, 2, 3. All right, that concludes our topic for today. Again, thank you to our panelists, Chris and Lauren, for joining us. Thank you, Dr. Yvonne Lee Long. We love you so much. We hope everybody has a great day and that you can join us tomorrow.
Thank you.